que está now.
Okay, Elastoderma by Sharina Medina. Overview of elastoderma. Elastoderma is a rare skin disease. It's typically found on the areas of the neck, the knees, and the elbow. Causes seem to be unknown, and a prognosis is determined on the condition of the severity. So what is elastoderma? So elastoderma is a rare skin condition that shows patches of loose skin that's affected in the areas of the neck, arm, or leg area. So we have some pictures of the neck, legs, and the arm. Due to the complications of the skin laxity, the skin of the area does not go back to its original location after pulling it, stretching the skin, or even pinching it. So therefore, when you pinch your skin, it would not go back to the original location. So now, elastoderma. Elastoderma is such a rare disease that it can be affected without being hereditary. And individuals that can have elastoderma is 1 to 300 in the United States. The common ages of individuals that can have elastoderma can range to their adolescent to adult years. Adolescents can be based off of 12 years old to 18 years old, and adults can be 19 years old up to 65 years of age. Okay, the causes of elastoderma. The causes of elastoderma is unknown. The results may come from the overproduction of elastin. It is believed that there's an abnormality in the skin production. Elastin is the type of protein that is able to benefit the tissues and structure conditions. So elastin is a connective tissue, and it helps the skin return to the original position after it's being pulled and stretched. So after, let's say, if your skin is stretched, you're able to come back to its original position. But therefore, if you have elastoderma, it will be in a delayed recoil. So the symptoms of elastoderma can include loose skin, sagging, skin that looks folded, appearance of wrinkly skin, and other symptoms can include the skin could look deformed, there's skin nodules, skin papules, hyperplasia. Majority of people that can experience with this condition can have various of symptoms. So it shows that eczema and other bacterial infections can be found on the top layer of skin that can be connected to the elastoderma. So there's other descriptions of the symptom that may be connected with the elastoderma. So you have the papule. The papule is this, which is a tissue that's elevated about 1 centimeter of the skin. And its appearance can be in different shapes or sizes, and it's not a disease. Premature skin wrinkling in this picture right here in the middle. It can contain irregular folds and indentations. It's the production of elastin is different from the regular age-related norms. And then you have the skin nodule, which is tissue that's abnormally grown from the skin or beneath the skin. So we have pictures of examples here to show you. So to be continued, there's other descriptions that can be connected with elastoderma, which could be hyperplasia, which is highly sensitive to the 5 senses, which can be your smell, it could be your vision, it could be touch, or it can be your eyesight. So we have a man here, could be for the example. Eczema, which is extreme dryness, irritation to the skin, which can cause uncomfortable rashes, redness, bleeding, and etc. So we have an example of a man with eczema with his hands. You can see that there's rashes, irritation, and then erysipelas, which is a skin condition that's right in the middle right there. It's a form of cellulitis, but unlike cellulitis, which affects deeper tissue, it's only affected the upper layer of the skin. So, it is a type of skin infection that is a form of the sebaceous connective tissue. So we have a case report, which is a female. She is age 33 years old. The symptoms started to occur at age 29 when she started to know the laxity on her right elbow. Physical examinations showed when grasping the affected area, the skin was identified as irregularly secured and it was lacking cushion-like consistency than the other elbow. So basically it's telling you that on her right elbow, it felt really hard and it wasn't cushion-like compared to the other area that wasn't affected. So stretching the elbow created a delay of recoil. The results of diagnosis found that there was no evidence of abnormalities. And so what we can show you from the next slide is the picture of it. Example A, which is the stretched skin when the physician tried to pull the skin. And then B, it was a delayed recoil for coming it back. So test and diagnostic process for elastoderma. So the test and exams may be used in the diagnosis of drug-induced dermatomyositis for elastoderma, which you need a physical examination or evaluation of medical history, assessment resulting in any signs of symptoms, using a dermoscopy, which is dermatologists use this tool to analyze the skin, which that could be a picture right there for example. A skin biopsy, which is the skin tissue examined by a pathologist. So after taking the tissue of the skin that's needed for the area, it will be looked underneath the microscope. And healthcare providers can operate different studies to eliminate the other clinical reports that enter for a definite diagnosis. Okay. So medication and therapy of elastoderma. So unfortunately there is no treatment for the condition, but there's other treatments that can be tamed, which you have to have an adequate skin care. Patients can undergo surgical removal of it. To enhance their physical traits, medical screening and physical examination, and there's no medication that can help with the condition. Therefore, even if they go through surgery, it is a possible chance that they might get elastoderma to reoccur. So here's a picture. So risk and complications of elastoderma. The complications of elastoderma include the lack of self-esteem, cosmetic worries, skin alteration, fungal bacteria, and secondary bacteria. There can be recurrence, like I said again, of after surgical procedures. Risk factors are quite unknown, but the outcome of the elastoderma depends on the severity of the condition. Why did I choose this topic? Well, I chose this topic because it was a rare disease. I wanted to learn more about it, more of the evidence of it. It is such a rare condition. 1 out of 300 people in the United States get a chance of getting elastoderma. It's also interesting to learn this condition, that it can affect adolescents because it's uncommon for an age related to get that type of condition. And it's also very interesting to learn that it's not hereditary. And I chose this topic because I enjoy learning about the skin. And here are my supports and resources. And that is the end of my presentation. Thank you.